introduce myself. I'm Dr. Bill Wyatt, and I'm a general dentist, but I've done nothing but orthodontics for the last 40 something years, mixed in with a little TMJ correction. I'm a member of the American Orthodontic Society, or the AOS, and this is an organization of general and pediatric dentists who whose sole purpose really is to teach orthodontics to general and pediatric dentists, and also to assist them in getting their practices going or any problems they might have in that. Today I want to cover one aspect of orthodontics that I call just bonded blocks, and I'm going to show you some cases where we use that. And we bond acrylic, usually triad acrylic, some soft acrylic, onto the teeth, open bites to allow us to put brackets on teeth and also jump cross bites and various things. And I'm going to go through a few cases showing that. This first case, we just put a bonded block on one side of the mouth. Let me see, I'm going to have to get this back over here. Okay, get my little dot there. A single block was bonded on the lower left to aid in jumping several anterior crossbites. So it was a very odd crossbite here on this particular guy. It's got a rather normal looking face with a little excess vertical height of it. And so I would prefer just the height of the face be more like this, so that this distance and this distance and this distance would be about the same in there, just to give a better balance of the face. So he's a little bit on the high angle side right here. When he smiles, you can see the teeth are in the crossbite, but not really as bad as the crossbite really is. When we trimmed the models up, we couldn't keep from breaking this lower left central off, which it went something like this, and it's out in front of the upper central, and the upper central is out in front of the lower lateral, the lower lateral is in front of the upper lateral. It's a real odd deal. So we had to open the bite in order to jump these teeth out, and get the central on top of everything and correct this crossbite. So we wanted to bond something on the lower teeth down here to open up this bite. And since this is a slight high angle case, we wanted to put pressure on the posterior teeth to help close it a little bit. So we were going to bond it over here. Now, the young man had, when you look at the case to start with, he had his upper 6-year molars had been removed earlier for some reason or other. The lower 6s had some problems, but not severe. You could have saved them, but we decided that since he had the wisdom teeth and the good second molars, and this tooth had some problems, so we decided to take that out, and then we'll just bring these 4 molars right here forward and close the space and put him in a pretty good class 1 relationship like that. Now the other side was very similar, and we decided to take the tooth out here and then have the second and the third molars underneath here. We're going to bring this segment forward and close up the space. Of course, after we have corrected the crossbite out here in the anterior part of the mouth. Now, to get this where we could get stuff on the anterior part of the mouth, we're going to have to open this up. So we come in and bond this. Now, we probably should have waited till we were ready uh, to close this, actually, till we corrected the crossbite to do the extraction down here. Then we could have brought this in here and not had this partly closed up while we were waiting on the correction of the crossbite. Here you can see the central upper lateral, which were in crossbite. We had our lower centrals out here, and the lower lateral was somewhere in there. So we had to correct that problem before we could close the bite down. So this tooth, both the 6-year molars had some problem, but we could have kept them if we'd have needed to. So rather than extract the wisdom teeth, which were good, we decided just to take the 6-year molars out on the bottom. Alright, we marked them out here on the x-ray, and the upper space had already closed, but we've got some good teeth down here, and these were filled, and one of them was decayed again, and so we decided we just sacrifice these, and we're going to take these 2 teeth, which are already 2/3 or more closed, and then we'll bring these up and have this one come into a class 1 relation with that. So we're going to close this space, bring all of this right here forward, and the same thing on this side. As we pull this up, we won't have any trouble uprighting the wisdom teeth and close this space. And we'll bring it forward on the bottom a lot more than we do on the top to correct the class 2 relationship and everything. Alright, here we start out, and you can see the crossbite in the young man's dental pictures right of the face. On the right side of the mouth now we've got a fairly good class 1 relation. On the left side it's not too far off. Of course we got the crossbite over here, and we need to expand a lot to get those teeth in place and everything. It's a little different. The palate, is, you can see, is pretty far up like that, and you may have noticed on the models of the upper teeth how these teeth had drifted forward and they rotated in. They rotate on the lingual roots, and so when you band them up, you try to rotate them back out a little bit, and that creates a little space that you bring that to. We'll kind of, the arch form is off too, so we'll try to broaden that out as we go. Okay, we got the teeth out and we're about ready to start, so we're going to bond the blocks, except I'm just going to bond a block on this part right in here and leave this alone, just left it absolutely alone, and show you what happens in a matter of 2.5, 3, maybe 3.5 months. We had the block over here and had opened almost a 1/4 inch, and these teeth came together in contact on the other side of the mouth, and they didn't exfoliate the teeth, they just, the alveolar bone, teeth and all drifted together on the left side of the mouth. So here we go, we've bonded this block, and this is 2 or 3 months later. We're getting the laterals out now, a little piggyback wire we had bent in and hooked to that. We made a space right here, and pulling this lateral through, made space down here and pulled this out here too, and brought that tooth in. And this lining it up in general, while we had that space, that's a pretty good size space over there. And when we first put that on, we had a gap on this side of the mouth just as wide as that is. Now these teeth have moved pretty much together at this point right here. I think we show these are not, they're not actually chewing at this point, but it doesn't like much being where we could get them together where he could actually chew. I think he did chew some over there, but not much occlusion. Alright, we've got to jump this lateral over. When we get it over on that side, we'll be ready to take that block off. So looking up here, and this is just a method of expanding the space in here, and you put a little distal root tip on this one, a little medial root tip on this to open up the gap, and now we're going to bring this tooth into this space right there, that upper lateral there will come into that. So on the bottom we're closing this gap. It's already, say the molar was back here, it's already closed up about that much. Over here we've got the blocks bonded on these, and so this space naturally will not close until we get these blocks off of here. Now in this case I just use some plain clear acrylic. Most of these blocks we'll bond them on with a kind of a tooth colored triad acrylic. Just don't put any real composites on, bonded onto the top of the teeth, or you just can't hardly get it off. Now this stuff will come off fairly easy. Okay, now we can see that the got the lateral over the hump, and we've got to do a lot of reverse torque on this lateral to bring that root out, and we'll do that as we go along here. And we've opened up space, lining this up down here, and everything's coming along pretty good. On the right side of the mouth, it's in a pretty good class 1 relation. The midline's almost on right there, and we'll have to level this arch out. Of course, as you close it, this tends to pick up here. We have to keep this root coming forward in here as we bring the crown forward. Now on this side we are about over the hump, so we're just about ready to go in and take the block off. The lateral tooth is in there now, and the tongue apparently is pushing on this because it's kind of detorqued it to some extent just on its own, just opening this gap up right there. Now it's across the hump pretty good, so we should be taking this block off in just a little bit. Okay, we've removed the block now, and you can see these teeth are way up like this, and he's sticking his tongue through a lateral tongue thrust maybe formed when we took this block out. Now the other teeth are just virtually together on the right side of the mouth. That's what's interesting about it. And this all went together over here while we held this apart over here. And the teeth now did not move on their own. The alveolar bone moved with the teeth as they came together. So here, now we've taken the block off, and it's a month or so afterwards, and now this is closing down together real good, and we're bringing this space up here, and this is going to level out almost ideally before we get through with it. Now here we are. I think this wasn't heading as close as far as that was a while ago, but we're in pretty good occlusion over on this side, the right side of the mouth. This is fairly close class 1, of course we still got some space to close back in the back. And the lateral is torqued out pretty good. And when we get into a rectangle wire, we'll put reverse torque in this, and that'll bring this lateral root forward like that. Line that up. You see this tooth is torqued pretty good. You see the root of this one is still sticking back in the palate to some extent. So we're going to have to torque or detorque that left lateral right there. Alright, this space is about half closed, and this now we've got about a third of it closed. It was probably back in here because we held this one open till we got the blocks off, you see, so it won't close as fast as the other side. Now here the young man profile, it'll get a slight reduction in that. Let me go back here. Now this young man, the parents weren't paying they haven't paid a monthly payment in several months, and we got to question them and trying to get them to come in and make some kind of payment. And this young man just flat disappeared. He just left the country as far as we could tell. We sent registered letters and everything that he needed to continue with the work. Let's go back and see. We had straightened the upper out. We'd done the real hard job. This side looked pretty good, and the bite has closed down considerably over here. But he just flat took off, and we could not contact the guy. So they owed maybe 6 or 7 payments on this case when they left. So I never knew what happened, but we had the majority of the work done. All I had to do is close that space and get those teeth in, and we could have finished this case really nice if he had just stayed with us. But he left. Okay, I'm gonna go in and show another case here. This is a young Oriental lady who's a young lady. She's a very fine person, and they stayed with us, and we had some odd situations in this case also, which I'll show you. That's not too good of a picture. She's looking off to the side, but she was missing her lower laterals. Both lower laterals were gone, and we did a kind of a measurement of the teeth to see this tooth right here was placed way back in the mouth, and so we'd have to open this gap up and bring the lateral out to this surface, to the labial. And so we decided on this case that if we took out the first bicuspids up here on each side, that straighten up the anterior, open this space, and then line up the lower. Now the lower cuspids had a problem in that they were apparently kind of fused with what in the buds were the laterals. We'll take a closer look at them. Now here's the right side where we're going to take the first bicuspid out, and we'll bring this cuspid back into this area and keep the class 1 relation and everything. Now the cuspid is really wide as you'll look at it, so we'll check that. Now this is an Oriental young lady. She's got a large marginal ridges even on the labial side of the tooth right there. So we advise smoothing that down from the labial side and also from the lingual side. Also, take that marginal ridge down. Now here we took out, of course, the bicuspid, moved this over, and brought this other lateral forward in this gap, and we have to shave this cuspid down just slightly to make it match up with the tooth size area of the upper anterior teeth. Okay, now when you look at it from the inside the palate and everything, and we're going to eliminate this, we'll bring this back part of the way. We're going to take this back over here and then bring this tooth down into place. And this tooth has these marginal ridges, and you need to come in and trim those marginal ridges, kind of make a shelf out of them. You see those large marginal ridges there, so that the lower anterior teeth can meet a smooth area. If a lower, say central, hits on one side of this marginal ridge and nothing on the other side, invariably it will rotate in this direction and be crooked. Now this would get hit here and it would rotate in that direction. So we recommend you trim these out some as you, and then make a little shelf for the lower anterior teeth to come and rest on, preferably up there. Now she's not able to get in there and brush those good, but we'll take a look now at the lower arch, and I'm gonna this young lady had a rather unique problem here. She was missing the two laterals, and they're gone here, and the cuspids were unusually broad, like the laterals had fused in with the cuspids a little bit. So we kind of did a wee bit of stripping on the cuspids, but if we'd have needed more room, we would have reduced them even further. But as it was, we didn't take them down very much, and that compensated for the upper bicuspids that we had removed, and it worked out quite well, as I'll show you here in another few slides. Now we only bonded the block on the left side in her case also, in the area here. So let's see. Now we put the intruding arch wires in on the bottom arch. You see this coming out where we had that little deal, and this was activated way down like this. We bring it up and hook it piggybacked over the other arch wire. Now this was the original conventional arch wires in the bracket, and then we put the intruding arch wire over that. It's pushing these teeth down. It also picks these up on this side of the mouth. Now it'll rear the molar up some over here where we've got this bond. It won't have any effect on the molar to speak of at all. And again, in this case, these teeth went together, and we had a space over on the left side, something like that. And we had a space over here that's just as big when we first did it. These teeth erupted together along with the alveolar bone structure. They came together. When we took this out, then these came down and they matched up. The occlusal plane will be absolutely straight right in there. So we'll kind of see that take place here as we go through it. This is just another view. This is the intruding arch back here. Comes in something like, and it's activated down. It's coming up, and you pick it up and engage it, and that pushes these down. Of course, I'm repeating myself there, but I guess it doesn't hurt. Some people may need it. Some people may be bored to death with it, but I feel like it's necessary sometimes to repeat yourself a lot of times. Now, this is it from another angle. On the side where the block is, this tooth won't raise up at all. On the other side, it would kind of cock back, you see, a little bit. But we'll level an arch this way with this intruding. Now, the upper arch was kind of flattened out anyway. It didn't need one, but the lower arch had this tremendous curvus fee, you see, coming in it, and we wanted to level it quite bad. So we did. the upper arch, which is pretty leveled out now, and we removed the first bicuspids, and we're closing the space where the first bicuspids came out. And I think we trimmed these little marginal ridges and left a little shelf that was being trimmed out, and kind of you leave a little shelf for the lower incisors to hit on that shelf, and you could actually fill this in with composite and just have a shelf all around here for the teeth to hit, and that would stop the bite from deepening. You see where this one's crowned out just a little here, maybe a wee bit there, little here, and the teeth come up and hit a rather smooth surface up here. Then they tend to stay straight better. That's the lower teeth, that is, stay straight better. Alright, looking at the lower arch now, we've done a tiny little bit of reduction on these cuspids. We'll rotate these centrals around like that. And line all this up, and you don't have to trim the marginal ridges on the lower teeth because they don't come into contact with anything to speak of. Now on this side where we took, we haven't taken any teeth out other than the laterals are missing here to start with, and so the laterals are gone, and we've got this second molar, first molar, two bis, and the cuspid, and then the centrals. And so we just come on around here and we'll let the first bicuspids serve as cuspids in here. We don't have to trim them up or anything. They work pretty well as cuspids. Now, a lot of people disagree with that, but I don't. I think they work. I've got cases that have done this too, and it'll be 30 years out or 35 or more, and they're still holding up fine. So I have no qualms about teaching you that you can actually use cuspids as laterals. I think that's a very good thing, rather than go back and putting artificial teeth in, taking something out at the back of the line. So here we go. We're just about to finish this young lady up, and the midline's lined up good right in here. Teeth are torqued pretty good, and everything's lined up good. The two centrals and the two large cuspids made these cuspids come almost in an ideal interlocking, interdigitating space. You see how this cuspid is socked in like that, and maybe when we see the other side we see how good it is, and it's locked in too, pretty good. Now this bicuspid will lean in here later after we turn it loose, you see, and the molars sitting in there, and I hope we've got the keys to the 6 keys of occlusion in there. Now we've got to close a little more space, and we'll have this lined up. These two teeth need to be rotated a little more. I hope I did rotate them better than that. Well, here's the end of the line, and you can see we open the bite where these teeth are real close to the bottom, and now they're up, something like that. So we have the lower anteriors hitting on a little shelf, and then we'll build a bite plate on the retainer too when we put it in. And you can see from the inside how this case looks. This is I think an upper lateral right in this area. The bite was deep way up in here, and missing the lower laterals, and we just worked that out with the cuspids. Okay, on this side looks good. It was good class 1 to start with, and it's still good class 1. Over here, of course we took the cuspids, the upper cuspids out. Let me go back and see. Now, we took right here's a central, lateral, cuspid, first, second bi, and all that. Alright, here's the central, lateral, cuspid, second bi. So this one is missing right there. We took it out, of course. Let me go back here. Alright, what we did here, we removed the first bis and backed the cuspids up into that space. And then we got a little bite plate in here with one kind of carved into the teeth. And a kind of a horseshoe type wraparound retainer. Now we extracted teeth here and here, and yet the arch form is actually bigger over here than it was here. This distance across from 6-year molar, 6-year molar won't be a great deal of difference, but it is a little bigger and flared out a little more than the other side over there. And that's now on the lower, those cuspids, those big broad cuspids worked out quite well. We never did get these rotated like I'd really like for them to be, but we probably bonded that together. I mean, on a 3-to-3 and keep them from rotating back anymore. Here's the cephalometrics to start with, how she was biting up in there, and here she is later on during the treatment. And I don't know whether I've got another one, but there's the Penrex when we started. We extracted the first bis and pull that together, pull the upper together, and since we're missing these lower laterals in here, we move forward some, and there's a little more room for your wisdom teeth, but I don't think this young lady has room in the jaw for the wisdom teeth. We closed all this together, and there's more room for the upper wisdom teeth. Now, a lot of times I just leave those wisdom teeth alone, and if we need them, and they're not hung up down here, I wouldn't want to keep this. I'd like to get it up here, even if it's buried up in the tissue to some extent. But eventually down here we make a decision to either keep them or take them out, one or the other. Well, here we are a little later. And we've got bands on these. Sometimes this tooth gets hung on that band, so we have to put a separator in there, move these tooth back a little bit, and then take the separator out and hope it'll come past the band, and the tooth will set in something like this. And a lot of times they'll have room for these wisdom teeth. And then you just wait on the upper one to come in. So here is, I guess, close to the end of the treatment. Well, the lower wisdom teeth, we took the bands off. You see, and that moved together, so the wisdom teeth have come up in here. And I think they'll be usable because this tissue is on the buccal side of the teeth, and this upper wisdom tooth can erupt down in here. This one doesn't look very promising, but we'll give it a chance to come on down and occlude against that. And the thing just worked out quite well, really. It looks good. Here's the young lady. Well, I thought I had some facial pictures of her here, but I don't. Here's another case that I want to go through, and this is a guy I know real well who's an extreme bruxer, and I knew some friends, knew him in high school. He's a big football player in high school, and he ground his teeth back then. I've never seen anybody grind them off like he did. They just looked terrible. Now all he wanted was to get his upper six anteriors lined up and crowned and his bite open. And so we did just that. We left the lower, I put braces on, but we did very little to them. Now, when I show you how much he's worn these teeth down, I've never seen anybody just ate the insides out of them like that. It had this deep, deep bite. Then we had straightened his wife's teeth, and she's a beautiful woman, and she has the most gorgeous teeth you've hardly ever seen, and they naturally were good, and we did a good job, I think, of straightening them. Then his two children had really nice teeth, so they kind of hog-tied him and brought him in to get these teeth lined up in front. And we did this with some bonded blocks, just bonded onto the teeth. Uh, so here's just a set of models showing you how it looked like that when we started. We did very little, if anything, to the lower. We could have just left it completely alone. Now, what I did here, I was trying to open this bite. We did band the lower anterior teeth, and I put one of these intruding wires that drops way on down here, raised it up and hooked it on here, and that's on there now. There's the conventional arch wire in the bracket. Here's your intruding arch wire coming over here. It's down here, and we raise it up and piggybacked it over the other one, and it's bringing the anterior part of the mouth down, and we want to open the bite some. So as we got it leveled out, then I came in and just took some triad tooth colored material and just kind of etched the teeth and coated them with this liquid they've got in triad. It's that same chemistry, and then got the stiffer stuff, worked it out and put it over that liquid material that we had on the teeth. And as you harden it, it hardens the whole thing to them. And took a little spatula, a little fine spatula, and kind of shaped these teeth and used something to moisten my little shaper up and made a pretty good looking set of teeth out of those. And then we could let him close together and see about where we wanted to make the height of the teeth. In other words, I didn't want him closing together and banging into the teeth, and yet we needed to give him some height to these teeth that he had wore down like something like that. And so we pushed these down, leveled them out, and then allowed him to chew on these front teeth. Well, I let him close too, actually, and make an indentation. And when I got him where I thought that ought to be the place, we stopped and hardened that material. Now you can add to it or take away from it. This is just another view of the model, but anyway, on the side, this is kind of what it looked like. That's the upper, you remember, and here it is uh, showing these little temporary triad acrylic teeth that we put in with a bite plate on them, and that worked out real well. Now his lower teeth came down and he chewed on this section of that triad. I tried to keep a little space on it so you can take a water pick and flush it out and keep that tissue healthy while you're waiting to get some restorations for the upper teeth. Alright, I got him leveled out about like I wanted. That's really, he didn't want anything further done to the lower, so I sent him back to his regular dentist. And the lower ones are worn out pretty bad, but we just kept them pretty much like they were. Alright, I sent him back in, and he was working out with a lab how to make a shelf in the crowns that you put in there. I wanted this shelf and the crowns that the teeth chewed against to be out of pure gold. I wanted that to be. So they built this up on the Typodon and fixed it where it bite together there. Then they took that and, well, let me go back, and they, I guess, cut these apart and waxed up the crown, but kept this little bite plate in the crown, you see, right here. And I'll show you those after they cast them. And it worked out really well. So they cast the teeth. I don't remember whether these were temporaries or the final product in here. Anyway, we leveled the bottom and got it closing up against the back of this. And when you look at these crowns, you see this is where those teeth were touching in that wax. And they cut them apart and kept that when they cast the gold portion of this. Then they just polished this out and placed it in line. And now this is a bite plate for the lower anterior teeth. And they go up against gold, so they don't wear like this porcelain. The higher fill porcelain is like a wet rock. It'll grind your teeth down like mad. But here where they hit and slide up on the gold, those lower anterior teeth might last him for a lot longer before he has to have them crowned or something of that nature. And so that serves as a bite plate to keep his bite from deepening any further. And so these teeth that are already worn bad, that he didn't want to go in and mess with, so we just leveled this bite out, and I left it pretty much like that. But these were worn down some, but that'll fit into that little gold bite plate, and it won't wear very much over a period of years. And here's the guy later when he just cracked his lips. You could see the teeth. You couldn't see them before. When he smiled, it showed the whole tooth structure in there, but no terrific gumminess to the smile. And that worked out quite good. And so this is I've got another case here that's a little bit complicated, and I'm going to skip over that case. So I'm going to go over here to pause. All right, we'll pick up here on case number 5. I just skipped case number 4. We show it in some other studies quite a bit. Number 5 was a real fine gentleman that worked for American Airlines, and he, if I remember correctly, is in charge of their computers. And they got a tremendous computer bank, and this was several years ago, and I'm sure he had a lot of stress on himself, and he had a temporomandibular joint problem along with a tooth grinding problem that I've never seen. But when we leveled and opened the bite, the temporomandibular joint problem went away. I mean, he's got a real close bite. Now, I've never seen anybody grind the lower teeth down this much, and he had these old porcelain crowns up here, and he ground those teeth up against the back sides of these crowns and just literally wore his lower teeth down to the gum line. You may have seen this much reduction in them before, and you wonder what to do. So I'm going to show you one of the ways of coming out of a situation like this. All right, the teeth wore against this porcelain instead of the gold. If the gold had to come up to along here and the teeth had a little shelf, he might have never got the deep bite, may have never worn the teeth down like that. But the teeth were rubbing against the porcelain, and it literally ground the teeth off to the gum line. I mean, the tooth's gone, and the gum line's right up here even with the tooth. I don't think I've ever seen anybody with them wore down quite like this. Now, this presented a little problem. How are we going to put a bracket on a tooth like this? You know, you'd have a devil of a time putting a bracket on it. So I didn't try to think of something better to do than that. So what I did, you may know already. If you don't, maybe you can use it sometime. We went in and put bands on these teeth, just metal bands, and we filled the bands. We etched this tooth, everything, with composite. And so we had a banded tooth that was full of composite in here. Now the bands had the brackets on them in here, so we had to open the bite, of course, to keep from chewing on the brackets and all that good stuff. And so anyway, here's what we did. And so we banded those teeth, and I put an intruding wire which would go way up here, you see, off like that. Brought it down, hooked it on, piggybacked it over the top of this is the conventional wire. It's kind of straightening everything up, and it's going to raise these teeth up, you see. And that's what I wanted to do. I wanted to kind of have a little reverse curvous V in the upper arch like this. Now this intruding wire down here was way down like that, coming up, and we raised it up, hooked it. It's going down with these teeth in this fashion. Now if you haven't done this, just study this a little bit. It's really not that difficult. And I know many of our members who went through with Dr. Garrity's was trying to keep things really simple to help people out. And I felt like, well, we really ought to get into it, you know. So he always thought that I was doing stuff that people couldn't do, but I don't say that you can do it, but I'm going to show you how we've done it. And there's many people have a lot of talent and can learn to do it, and that's what I wanted to pass on to people. Don't just run away from the darn cases. Figure out how you can do it. And I'm going to show you the ways that we've done, and maybe that'll give you some ideas in doing this. So if you don't know how to do the intruding wires, you need double tubes on the lower and triple on the upper, and you put the intruding wire in that extra deal up above and down below, and you make it where, I'm sorry, that thing keeps coming up there. You make it where you activate this intruding wire. You can go way on up here if you want to, but you can't try it in like that. If you want to put it in and then hit it with an optical plier, you can put a lot more activation than we've got on these. And that double optical pliers, one that has a kind of a trough like this, and then a bar underneath the trough, and you put the wire between it and mash it, and the wire that'll be going through there straight, it'll bend it down like that, or like if you mash it harder, you can put 45, 60 degrees or more torque into that. So you don't want that much, but you might want a little more than this. Then you can try this in right here, so you could activate it, put a lot more force on it if you want to. Alright, this picked these teeth up, brought these teeth down, and we opened some space in there in between the teeth. and the dental friend of mine who sent him in. And by the way, when you open the bite, the mandible moves forward. And when it did, his temporomandibular joint went away. And this is not really generally known among the orthodontists and general dentists doing this, but people that do temporomandibular joint work realize it. Now you don't have to go through all this rigmarole and buy these machines and figure out exactly how the jaw closes. You just let somebody close naturally and within the way the jaw wants to close. Once the teeth hit, the brain moves the jaw so the teeth can come together. So if you figure out and you put everybody where their jaw is comfortable where it wants to close, very few of them have TMJ problem, and it'll help the vast majority of them. I've just been doing that for years, and that works. So anyway, we open the bite, then the guy's jaw comes forward, and we intrude these teeth, and that is that intruding this makes spaces come in here, and I had room to put in the bicuspids and everything else. I'll show you that as we go through here. So here is, we've got an expansion. This is an expansion loop in this wire coming in there and ran a spring on it, so it's pushing on this pretty hard, you see. As we go down with these teeth, they open out and we have space open up in between there. And then when you have room, his jaw move forward closer to class 1. So the class 2 problem tends to be reduced when you open the bite. Now you wonder how the jaw goes forward as much as it does on some of these cases. Actually, the gonial angle of the jaw down here kind of increases. The head of the condyle may kind of move back like that, where it might have been straight up and down here, and now it backs up, but your jaw will move out much further. If you x-ray the jaw joint won't look like it moved all that much, but yet the jaw moved forward maybe 3 or 4 millimeters, 5, sometimes like that. And you say, well, we didn't make the jaw grow, we didn't do that. If you straighten out the gonial angle, that'll make this come forward. If you push the condyle backwards, or if the condyle just goes backwards, when you bring the jaw out, then the jaw will come out, and the condyle kind of changes the position it's in right up here. And that is a good thing to know, you know. So when you're worried about class 2, how much class 2 problem have I got? Don't take a deep bite case that's class 2 and say, well, I've got so much class 2 here to treat. Open the bloomin' bite. And when you get the bite open, the jaw will kind of go forward. Frequently, you won't have any class 2. I'll tell you, they put class 3 elastics on them. Or they're not very hard to correct. They're just easy to correct. Simply, the jaw will move out, it moves forward, and you've been squeezing it back all this time, making this angle smaller. As you free it, the angle gets bigger, and the head of the condyle's been pushed back in this direction, and now it kind of goes back like that, and the jaw comes out in front. So your class 2 problem is not near what it was when you were looking at it when the patient was class 2. So this is just an important thing for anybody doing orthodontics to know. Alright, so we brought him out. We had to wear a bite plate in here so we could get brackets and everything on those bands and all that. So we got him leveled out. You see now these teeth are up here and we got space. Got bands on there going down. Well, his regular dentist that sent him in, he went in and he saw all this space, and he just went ahead and took the darn stuff I had on there off and crowned the teeth and sent him back to me. And like that, with the intruding wire still on the upper. So I had the teeth crowned already. Opened the bite, and there's the crowns that was put on those lower anterior teeth, you see. Now, later years, he came in and got some decent crowns up here. These look like the devil. I don't know where they were put in. I don't want to. I don't want to know. Anyway, I don't want to. I wouldn't want to go to the guy and put those crowns in. But anyway, he came back and had some nice crowns, but I don't think I have pictures of them. Okay, we put a wraparound retainer. We got a bite plate in here. We had a little spacing in here that you don't try to close that space. I got these teeth interdigitated. Now, if you want to fill that in with some filling material, okay, go ahead and do that. When he had them recrowned, well, of course, they closed that space up like that. Okay, he's back in class 1. These teeth have a gap in them up there, but he could have that filled in. Now the lower teeth lined up good, and he's in a socked in. He's got the 6 keys in the molar. They're working fine. His temporomandibular joint problem went away, and look at the space that he had here for this bicuspid. Look at where this cuspid went. Now I didn't have this big of a class 2 problem. Now when I level the bite, in other words, we put these wires and pulling down on this and coming off of here, way up here, we picking these teeth up. The teeth move toward the gingiva and the bone goes with them. God knows how I've been trying to pass that on to people, and they do not believe that you can put teeth where there is no bone and the bone goes with the teeth. Now, if you take one tooth and try to pull it out and shove it way out, you might pull it out of the bone. But if you take a group of teeth and expand them and go with reasonable speed, which is pretty fast, and the bone, the alveolar bone, goes right with them, and I don't have any proof, but I'll guarantee you that the basal supporting bone under the alveolar bone eventually moves to support it in an efficient way, and it moves out to do that properly. And I know that happens, but I don't have a way to prove it. Okay, now let's look at where this went to. Now in the front, you see the deep bite, and that's when we started in 1993. Let's see, started 3 of 93. I don't know what this 2 of 92 is right here. That may have been something in there's wrong. One of those isn't right. Okay, that was when we started. And maybe this was the original, but we didn't start working on them until 93. Now you think, God, you can't possibly put these teeth into that space. But I'll tell you, when you open the bite, these teeth will move forward as they move down, and spaces come in there, and the mouth move forward too, the mandible move forward, and we still had room for these teeth to come in. Now let's look at the teeth after they get in. Now there's the way it was wore down, and here he is later when we finished him up. I hope I've got some finishing stuff. Now he came back and had some good crowns put on these teeth right here. Maybe American Airlines paid a little more, but you see what sorry crowns these are. I mean, it looks like somebody's stuck a bunch of wax on your die and mashed a hole in it, an impression in it. There's just no anatomy to it at all. And these are ground down and these are crowded out, and when we finished we took none of these teeth out, you see. that was ground off like that. Now here it is, 93. We had the intruding wire. See, this wire right here is really going down here, and it's pushing down on these teeth. And if you haven't tried intruding wires, man, that's one of the best things you can get into. You have to put triple tubes on the upper 6-year molars and doubles on the lower 6-year molars. And your conventional archwire slot has to be convertible, because if you make a bend between the first and second molar, you got to convert the conventional slot in there. Alright, here's this teeth, and you watch me. When we go down with these teeth, we go level it out, and we made room for those teeth to come in when we opened up like that. And now we've got it opened up, these are down, this is lined up, and here is that bicuspid. It's out over here into space. And you can see the other bicuspid is in. This one is in just perfectly fine. All the teeth are lined up in here. This one should come out a little bit more, and maybe it did. I don't remember exactly. But here it is. He had the crowns put on before actually I wanted to, and I may not have finished that. This tooth is out some, but I really didn't bring it out as far as I would like right there. And these are those sorry crowns which I think he had done over later. So there he is. We've opened the back. Temporal mandibular joint problem went away. We expanded the teeth. The jaw is further forward than it used to be, and so it has no TMJ problem anymore. And we had room for all the teeth to line up in there without crowding or anything. And I hope you learn how to do orthodontics like this. If you're just beginning, don't jump on these cases. But after you get into it, if you see what we did here, you can do this too, and see where that cuspid is right in the spot right there. And back when we looked at it before, it wasn't. Now we put a wraparound retainer on the bottom. I just wanted something to hold that pretty good. But you have nothing, and don't run anything across the dadgum occlusion of the teeth, or you screw up the retention and you screw up the finishing of the case. Now, I don't say these are not Hawley retainers, because everybody thinks the Hawley retainer has little old clasp on it that go across the occlusion. We have nothing over the occlusion, and I call them strictly wraparound retainers, and you can fix them where you can keep them in the mouth like mad, and you do not need clasp on them. You can put them in there so tight you can put hooks on them and use class 2 and class 3 elastics off of them if you wanted to. Alright, here he is finished up, and he has no TMJ problem. The teeth are lined up, his jaw is further forward, and his joint is fine, and he's happy. I think he is. But if I was running all the dumb computers in American Airlines, I wouldn't be too happy. But he had another lady in his office who's had joint problems. He sent her in, and we got her fixed up finally, but I don't have any pictures of her. So here he is. Excuse me. Alright, and that class 2, this cuspid is sticking out here when we started, and it's back there. And he got a space in there, and he needs to have that filled in. But don't try to push this tooth up to fill that space. Just put something in it. But you got it interdigitated, keep it interdigitated. Okay, that's the finished case. And that's the end of this bonded block series. and I'll have to go over here and close it out some way or another.